So if we have a look really carefully here, can you notice on one side how the teeth are wider and magnified? And then on the other side, the teeth are too skinny. So which side is too far away from the focal source and too close to the sensor? Is it the left side or is it the right side? The left side. So the left side is too close to the sensor, so the object film distance decreases, and then we can get a variation. Vice versa, if we have the object film distance increasing on the opposing side, it's going to get a lot wider. So if this patient had their left side being really, really close to the sensor, what does that mean? How would their head be turned? So you'd get your physical left, you'd turn it to the sensor. Okay, so then as it's going around, too close to the sensor, right side is too far away. So how would you correct the patient? You'd move them back to there. So what I kind of remember is I always look at the skinnier side, and if it's the skinnier side on the left, it's the left to the left. The patient's left, that is, to the left. And vice versa, if it's too skinny on the other side, the right to the right. It's kind of the way I remember it. So here you can see we've got this side being too skinny, this side being too wide, this side is too far away from the actual sensor. And so notice how the mandible increases in size. So notice how the ramus is a lot wider here. So if you're ever unsure if you've got rotation in your film, number one is look at your teeth. If one side is bigger than the other side, then that's a pretty good sign. But if you're really, really unsure, if you're thinking it's on the border, get a ruler and measure out your ramus. And usually we allow about a 5mm variance either side. So if there's greater than 5mm, we usually classify this as rotation on your films. So A, it's because the patient's either not centered on the bite stick, or B, it's because they've got their head turned. So do you think if you're looking at this little white area here that the patient was centered on their bite stick? So there's the end of the bite stick, there's the end of the bite stick. It's not too bad, okay, so they're pretty centered. Okay, not too bad. So again, this one will probably be a slight turn. Okay, whereas if you saw a bite stick sticking on one incisor and not on the other, that might be a sign that they're not quite centered in the unit.